Hello.
I'm having a high fever and I feel very weak and I have weight loss. Sometimes I even cough blood. So may I know what's my problem?
Okay, I think you might be have tuberculosis. Actually, tuberculosis is a contagious bacterial infection that mainly involves the lower respiratory tract of the lungs, but sometimes may spread to other organs as well. This TB caused by the Mycobacterium tuberculosis and Mycobacterium bovis.
Okay, so basically, this disease spreads when a person with active TB in their lungs coughs or sneezes, and someone else inhales these expelled droplets. Although tuberculosis is very contagious, it is not easy to catch. Latent TB is when the bacteria infect the body but do not cause any symptoms. However, active TB is when the infection begins to cause symptoms within weeks, months, or even years. People who are at great risk of this disease include those who have weak immune systems such as HIV, or even those who have treatments that weaken their immune system such as chemotherapy. Also, not forgetting those with poor health or even with poor diets. And lastly, those who live in crowded areas.
So now we need you to get a diagnostic test.
Go and meet Dr. Irene, diagnostic section.
Thank you. Hi doctor.
Hi,
Nice to meet you.
which is your PPC, please?
Here's my sleep results.
Looks like you're here to test for tuberculosis.
Yes, sir.
For tuberculosis, one is the most common one, is chest radiography, also known as chest X-ray. Another one is the Mantox test, where I, as a doctor, would inject 0.1 millimeter of PPD tuberculin into your intradermis, and 48 to 72 hours later, I will check for a swelling or a bump. The third step is acid-fast staining. We will take a sample of your saliva to check for Mycobacterium tuberculosis. We will stain it with carbon fusion and methylene blue, and if it stains, that means it's positive for Mycobacterium tuberculosis. And last but not least, not very common method, is interferon gamma release assay. So for your condition, I'm going to do a Mantox test. I would like you to come back 2 to 3 days later so I can check the site of injection.
Yes, sir. Thank you. Hi doctor. Long time no see.
Long time no see. How are you?
Quite fine. So how's my result?
So basically, if you had tuberculosis, the site of injection would show a red raised box. So sir, good news. You don't have tuberculosis. Congrats. I recommend you to meet Dr. Lee.
Okay, so we have some ways to prevent the TB disease. Okay, so the first one is every time you cough or sneeze, you have to take the tissue paper and cover your mouth. Okay, then you have to throw the tissue away into the rubbish bin. Then the second one, you have to wash your hand every time after you cough or sneeze every time. Okay, and then the third one is to improve the room air ventilation. So it's like you have to switch on the fan in your house or in your room, and also open the window. So the fourth ways is to avoid close contact with the TB patients, like in the hospital or the crowded place. Yeah.
Doctor, I will follow your advice.
Okay. Bye.
Tuberculosis right now is actually 3 times deadlier compared to malaria and HIV or AIDS. What I'm going to tell you guys today is right now there are more focus on multiple drug resistant TB. The multiple drug resistant TB is whereby the bacteria, the Mycobacterium tuberculosis, is more resistant to rifampicin and also the isoniazid. This is what makes them so difficult to cure. Actually, TB is curable, but you need to have a course of 6 months treatment. But right now, since there are multiple drug resistant and also extremely drug resistant TB, it makes them difficult to cure. From 6 months, it's already increasing to 2 years treatment, 2 years course. Right now, there is a more better antimicrobial drug, which is known as beta-kilin.
You have no tuberculosis.
Oh yeah!